Well, good afternoon and welcome to this November 2022 edition of Arizona Community Grand Rounds. We are very pleased to have a panel of fantastic folks joining us today for today's topic. And before I introduce the panel, if you're new to these rounds, just wanted to mention to you the history of the rounds and a little bit of housekeeping. My name is Mark Carroll and I serve as the Chief Medical Officer for the Medicaid plans of Blue Cross Blue Shield of Arizona. And we co-host and co-facilitate the rounds with the NARB Institute and my friend and colleague, Mary Jo Gregory, the President and CEO of the NARB Institute. Thanks, Mary Jo. We hold rounds regularly throughout the year, and we'll be announcing in the upcoming weeks our topics for rounds in 2023. So please stay tuned. If you are not aware, we'll mention that rounds are recorded and are able to be seen. We post the recordings within a couple of days on the NARB Institute website. And in the chat function, Jennifer Pierce, who sits behind the scenes and supports these rounds, thanks Jennifer, really appreciate your help. We'll put in the link to where you can get to that recording, and anyone's free to reach out to us if you have difficulties or challenges connecting to that recording. For folks who have joined today, you are on mute, so you're able to ask questions in the Q&A function. We encourage you to do that throughout the course of rounds. You don't need to do that, but you're welcome to do that at any time, and we'll do our best to get you your questions, your comments, and reflections that you may have to offer us. So I will love to launch today's rounds, which is entitled Raising a Child with Down Syndrome, an update on research, resources, and service gaps. By introducing and reading the bios for our three panelists, and then I'll turn it over to our panelists to share the information they have for us today. Their bios are so impressive that I am going to read through them with a little bit of extra length, just to share with you the diversity of their background and perspective. Our first panelist is Jennifer O'Connell. She joined the Down Syndrome Network of Arizona in January of 2022, bringing to the network over 25 years of multi-talented and multicultural business experience in corporate, small business, education, and nonprofit sectors. Jennifer has worked in corporate sales within global technology markets for many years before successfully opening and operating. I really was intrigued by this, Jennifer, one of the first local organic vegan restaurants in Phoenix, voted by Phoenix Magazine as one of the best new restaurants in 2006. Following the birth of her son, Liam, who was born with Down syndrome, Jennifer's heart turned to the field of education, where she offered her business expertise, serving as a director of business operations for a K-12 charter school. In 2016, she was awarded the Arizona Charter Business Leader of the Year finalist by the Arizona Charter School Association for establishing sustainable business practices, reinforcing school values, and business partnerships. Most recently, Jennifer served as the Director of Membership Development and Engagement for Arizona Forward, a nonprofit organization leading the change for sustainability and the charge for sustainability in Arizona. In addition to her business career, she has a heart for health, nutrition, volunteerism with a long history of supporting the Spanish-speaking community, in addition to hospice work, quite a range of committed activities, Jennifer. And she holds a bachelor's degree in Spanish and a master's degree in international management from the Thunderbirds Global School of Management. So welcome, Jennifer. Following Jennifer's comments, Dr. Dannah Raz will speak, and Dr. Raz is a developmental pediatrician at Phoenix Children's Hospital. She's a graduate of the University of Arizona College of Medicine in Tucson. Dr. Raz completed her pediatric residency at Phoenix Children's Hospital and the Maricopa Medical Center. She left Arizona briefly, I'll note, to pursue fellowship training in developmental and behavioral pediatrics at the Children's Hospital of Colorado. That was a good reason for a temporary departure from Arizona, Dr. Raz. And during that fellowship, she also completed an MPH, a Master's in Public Health, at the University of Colorado School of Public Health. Dr. Raz is very pleased and happy to be back home in Arizona, caring for children with developmental pediatrics, in developmental pediatrics at the Phoenix Children's Hospital. She has a special interest in providing comprehensive care to kids with developmental and intellectual disabilities, as well as educating primary care providers and pediatricians, such as myself, in caring for these children. Dr. Raz is the director of the Pediatric Down Syndrome Clinic and is one of the physicians in the neonatal early childhood screening clinics. Thanks very much, Dr. Raz, for joining. Oh, I missed one key part. When not at work, she enjoys spending time with her husband, two daughters, and a dog. And I was thinking of your dog, Dr. Raz, because I forgot to ask you for your dog and daughter's names. So excuse me. Elizabeth, Liz Archuleta, Liz, you're like a doctor from my vantage, has served on the Coconino County Board of Supervisors, representing District 2 from 1997 to 2021. Quite a number of years of service in that role. Liz attributes her success to the unwavering support of her husband, Franklin Willis, and their son, Demetrius. And Demi, if you're watching today, hello to you. With a passion for service and a commitment to community, Liz has lived a life of leadership, increasing education and economic opportunities for residents of Coconino County, and helping children and families prosper. A champion of diversity, Ms. Archuleta made it her life's calling to ensure that everyone has a voice. Only at age 31, she became the youngest person, the first Latina to be elected as a Coconino County Supervisor. She's influenced national policies, attracted resources to the Northern Arizona region and to Arizona, and created the Coconino County's Diversity Council to advance equity. Liz has served as board chair multiple times and led the county through unprecedented challenges such as devastating wildfires and floods, as well as the COVID-19 pandemic. And in 2021, President Joseph Biden appointed her to a senior position in his administration as the director of the Office of External and Intergovernmental Affairs in the U.S. Department of Agriculture. So thank you for letting me read your most impressive bios by way of introduction. I think I'll turn over the presenting platform to Jennifer. Thanks very much.
Thank you, Dr. Carroll, and thanks to the NARVA Institute for the invitation today. Thank you, Mary Jo. I'll go ahead and share my screen.
And again, while you are doing that, just to remind folks to please enter comments, thoughts, reflections, and questions you may have in the Q&A as Jennifer presents. Over to you, Jennifer.
Can you see my slides?
Yes, they look great.
Okay,
thanks.
Perfect. All right. Well, again, I'm Jennifer O'Connell. I'm the Executive Director for the Down Syndrome Network of Arizona. And just a brief kind of description of who we are at the Down Syndrome Network. We are a statewide nonprofit, and our mission is to educate, advocate, and support anyone in the community touched by Down syndrome through an open, supportive, and collaborative network. We were established 20 years ago and back in early 2002, and we serve over 450 individuals and their families across the state. And we offer a variety of programs for all ages, pre-birth, the children. We have a 0 through 7 group, a tweens and teens group called Tweens and Teens Up, and an adult group called Excel. And myself and my staff, we are all bilingual. We speak English and Spanish. In addition to these programs, we do education like we're doing now with the community, and lots of fun events, lots of great parties throughout the year as well. I call them parties with a purpose. So here is Liam. Liam's 13 years old. I have 2 boys. My oldest is Diego. He's 29. He's married out of the house. And Liam is with me in the house. He's 13. And he was also just recently officially diagnosed with autism. So he has a dual diagnosis of both autism and Down syndrome. And why I do this work is because Liam's entry into this world was difficult. And so I always consider myself to be an advocate, and I'm very, very grateful for the medical community. But I'll show you this picture of when Liam was at the NICU at PCH with his little, he doesn't have his cool cap on at this moment, but Liam was born breech, and despite 3 ultrasounds, no one ever picked up that he had 3 little holes in his heart. And so it was a very difficult birth with an APGAR score of 2. Both Liam and I almost died. In fact, the doctors had gone out at one point and told Dad that we probably wouldn't make it. We were both here. We made it. And it was a rough start, and many difficult years with feeding tubes and oxygen at home and open heart surgery and many different things. Now today I can tell you Liam does everything on his own pace, but it just takes that much longer. And so we've come a really long way. One of the stories is when I did wake up after the surgery, after giving birth to Liam, not knowing that he had Down syndrome, I said, well, where's my baby? And someone came over to me. I don't know who the person was in the hospital. And they said, your baby has a fat tongue, funny ears, and Down syndrome. That's how I was told that my child had Down syndrome. And that was a shock. In fact, I said, that's not my baby. You go find my baby. And Liam does have funny ears. He has little folded ears, and he does have Down syndrome. To hear that at those first words were very difficult as a parent. Liam was then taken to PCH for his care, and where his father, my husband, who speaks Spanish, the attending physician at the NICU at the time spoke Spanish, but Spanish kind of Argentine Spanish around the 1950s, and used the term mongoloid and to Hector at the time, Liam's father, and also referred to the little crease on his hand, the mark, and the simian crease. But in Spanish, simian refers to monkey. So Hector was so confused. I called him. I was in one hospital, and he was at the NICU, and I said, "Well, how is our baby?" I just got the news that he has a fat tongue, funny ears, and Down syndrome. He goes, oh, he's the cutest little thing. He's adorable, but they keep saying that he's a mongoloid. And he goes, I don't know what this means. So that was our start. And that's kind of what this education that I do, thanks to Dr. Raz, and I educate therapists and social workers and residents, and we go through some of the slides and some of the training that you'll see here in the next few minutes. So I start off, we won't do this just from a time aspect, but I start off the trainings with this QR code, which you could, pull up on your phone, and you take this quiz. And there's 11 questions here. And every time I've done this, whether it be for residents or doctors or therapists, I've done this for doctors of, OT, PT, social workers. I just did one for a social work agency. I've never had a group ever score a perfect score on this. And so things that I think might be basic just sometimes aren't. So it was just kind of a learning opportunity, right? Down syndrome is a birth defect. And so all of these are actually false. Down syndrome is not a birth defect. In fact, recently in news, the WHO and the CDC were criticized for naming it a birth defect. It's not a rare genetic condition. It's the most common genetic condition. Most moms are actually under 35, not over 35. We know there's 3 types of Down syndrome, not just one. It's not correct to say Down's baby. Or Down syndrome adult. We'll go through some of the language here in a few minutes. Lejeune, this is a debate, but there's a new award given to a female who actually discovered the karyotype. All babies born with heart defects. Now we know about half have some type of heart issue. The life expectancy is a 60 now, and this actually just changed. DDD just added Down syndrome as a qualifying category, and this was just posted a few days ago, a new policy, and we don't have a clinic. We have a clinic dedicated that Dr. Raz leads for the pediatric population, but Arizona does not have a Down syndrome clinic dedicated to adults. So it's more fun when we do that and we can see everyone's answers and all of that. So, but this is one of my favorite definitions of Down syndrome, and that Down syndrome is a naturally occurring chromosomal arrangement that's always been part of the human condition. As long as there has been people on Earth, there has been Down syndrome. And Down syndrome usually causes varying degrees of learning and developmental delays and some associated medical issues. And all these great photos are just from our last World Down Syndrome Day celebration that we had in the city of Peoria last March. So we know, like I said, it's not rare. It's the most commonly occurring chromosomal condition. 1 in 700 babies in the US are born with Down syndrome, about 6,000 births a year. And births are tracked in the state of Arizona, and they're tracked by county. It's estimated around 400,000 people with Down syndrome in the US. And we don't have numbers for the state of Arizona because DDD is the Division for Developmental Disabilities is now actually tracking as it's a category. We will have numbers going forward, but currently we don't have an exact number of how many people with Down syndrome live here in the state. And it affects all races, all socioeconomic levels. We know that with quality education, a stimulating home environment, good access to good health care, supportive family and friends, that people with Down syndrome lead fulfilling and productive lives. And I always say, well, isn't that the case for all of us, right? Good access to healthcare, education, and family and love. We all lead good lives. Many of you might know this, but I still think it's good, really important. Words do matter. It's not Downs with apostrophe, it's Down syndrome, named after Dr. Langdon Down. It's always people first, right? So a child with Down syndrome, a child with autism, an adult with Down syndrome, not versus, the Downs baby, or he has Downs. And then instead of using that word normal, the word typical is always preferred. And then there's lots of campaigns that have gone on throughout the years with the R word, right? That the word mental retardation has been replaced using intellectual disability or cognitive disability or delayed learning. So those are the basic guidelines on preferred language. So just to give you some historical context, this is some interesting information that in my research, back early history, 1500 AD, the Olmecs are actually thought to have worshipped people with Down syndrome. You can see this first little statue right here with the hypotonia, that super flexibility that often people with Down syndrome have. Here are these Olmec heads, and they have features of people with Down syndrome. They were thought to be kind of semi-gods, those that were born with Down syndrome. And then I just threw these in. These were some fun photos of paintings, Flemish paintings, and I think the other one's an Italian painting, of angels, and they have features of children with Down syndrome here around the baby Jesus. Fast forward into 1862, that's when Dr. Down, he was the first physician that described Down syndrome. And the term was used, mongoloid was used. And the life expectancy of somebody with Down syndrome during that time was around 10 years old. Fast forward to 1959, where we made a lot of Discoveries, with genetics and the karyotype techniques. Here's a karyotype here where you can see the triplication of the 21st chromosome. And there's this debate, like I said, who discovered it. And so Marthe Gauthier, on my French pronunciation, please forgive it, was actually awarded the discovery in 2014. Institutionalization was common, so people that were born with Down syndrome would go into an institution versus going home with family. And life expectancy was around 15. And then fast forward, right, we have the 60s, 70s, 80s, 90s, where you have a lot of human and civil rights activists and medical, social, and educational advancements happening. So people are still going into institutions, still very common, but the life expectancy does increase to 25. And then now, kind of here in the 21st century, we know we have a much more advanced genetic screening. There's a range of, kind of depending on what source you go to, in terms of termination rates. For abortion, I've seen as low as 60 to 90%. We know in countries like Iceland, Down syndrome has been almost completely eradicated. And then there's been discoveries in genetics where this chromosome 21 is tied to Alzheimer's. And now the life expectancy is 60 years old. There is some disparity, though, depending on socioeconomic and race, where we've seen that life expectancy is lower depending on what background. I know I'm running through this quick, but I have a lot of information to share. So one of our big advocacy efforts that I got to be part of when I joined Down Syndrome Network, the leadership team, was thanks to our advocacy committee. We had received a grant and we hired a PR firm to help add Down syndrome as the 5th qualifying diagnosis. So previously, for families to get services through the Division of Developmental Disabilities, they had to fall under cognitive disability, cerebral palsy, autism, or epilepsy. And Down syndrome typically fell under cognitive disability. There was quite a burden on the families and the process. So one thing we did was we advocated to add Down syndrome as an eligible diagnosis. And it was passed successfully. We went down, Michelle Udall here was a representative that backed the bill. Self-advocates came and testified along with parents. Here's one of the self-advocates giving everyone a hug after testimony. And so there's still another step in the DDD process that I just like to say. That doesn't mean they automatically, somebody with Down syndrome, that if they apply, they automatically get enrolled in services. They still have to show the significant limitations, functional limitations in their daily life skills. But the policy was just posted on October 28th, and the documentation now required is a simple evaluation report by a doctor, your developmental, pediatrician, geneticist, with a report with either prenatal or postnatal genetic testing. So this is a big win for us in the advocacy world here for Down syndrome. Here's my oldest son, Diego, when he first met Liam, when he came home from the hospital, Diego and Liam. And when Diego first met Liam, he said, "Mom, I never thought I could love someone so much." And these two are still very connected. And I love sharing this information. It's a study that you might be familiar with that Dr. Brian Skotko published in the Journal of Medical Genetics back in 2011, where he surveyed all these parents and siblings and adults with Down syndrome. He has a sister with Down syndrome, and so that was kind of his reason by doing this. But out of the 2,000 parents that were surveyed, close to 80% of them said that their outlook on life was actually more positive because of their child with Down syndrome. And siblings, when they asked, 97% said that they had feelings of pride for their brother or sister with Down syndrome. And 88% of them said they were actually convinced they were better people because they had a sibling with Down syndrome. And this is, I love this part, the adults, when they were asked, an adult with Down syndrome, how do you feel about yourself? 99% of them said they were happy with their lives. 97% of them said they liked who they are. and 96% said they liked how they looked. I bet if we asked our audience here those same questions, we wouldn't get those high percentages. And so I share this with doctors and medical professionals just so that our families, I am biased, right? I think I hit the lottery and I'm super blessed to have a child with Down syndrome and would love everybody to have this experience. But I want doctors to receive, to pass on to their families to receive accurate and unbiased information, right? And knowing that raising a child with Down syndrome can be a fantastic experience. So I asked that of the medical community to offer balanced and accurate information. Right now, from studies that I've read, 25% of physicians admit to emphasizing negative information and urging parents to terminate their pregnancies. 81% of students, medical students, said they hadn't received, sufficient clinical training regarding working with people with intellectual disabilities. And 45% of OB fellows say that their training to deliver a diagnosis was barely adequate or non-existent. So it wasn't a big surprise that 13 years ago, how I was approached with getting the news, the unexpected news, is because there's still some training that needs to be had. And I go into depth when I do a half-day training with the doctors, and we kind of go into what are we all have implicit biases. I'll give another example. We were referred to, remember how I said that Liam had these funny little ears that fold over? We were referred to a plastic surgeon, and we went to the plastic surgeon, and the plastic surgeon said, oh, well, he doesn't need to have his ears fixed because he'll never have friends. So the plastic surgeon said to me, right? So some of this or one of the, in the NICU, one of the residents said, well, aren't you concerned that he'll always just be a laborer? And so these comments, and my husband, who's a farmer and a gardener, was like, no, he wasn't offended at all by this comment. I was the one who was offended because of my background in education. So when you think of like the lens through maybe that clinician where an intellectual disability could seem, I don't know, scary or daunting, right? So all of us have implicit biases, these unconscious biases that we don't really realize. And so it's through our work, through education, through recognizing this, that we can see that. And there's, in studies, we know that there's a preference for people without disability. It's one of the strongest bias. It's actually second from the studies. Age tends to be first, and then people with a disability tend to be second. But 40% of doctors say that they're confident about providing the same quality of care, but that's only 40%. And 18% agreed that the healthcare system often treats these patients unfairly. So there is a need here for more training. Here's some typical stereotypes that I've heard, throughout the years. And some of them are, like they can't go to college, or they're always happy. Maybe it's the stereotype on the other end. Oh, they're always so happy. Or they have older parents, or, oh my gosh, it's going to ruin your marriage, or they can't have children, or they'll definitely get Alzheimer's, right? These are the kind of stereotypes that have come up throughout the year. And here's what I was talking about, kind of through that lens of a clinician, right? So if a healthcare provider has spent years of postgraduate training, then maybe valuing the potential of intellectual achievement, kind of unconsciously, that may involve an intellectual disability may be seen as devastating, right? Or maybe a provider is always taking care of hospitalized children and seeing a lot of complications and never managing them when they're healthy. So there might be some reasons behind some of these biases. So in the training that I've done with doctors about giving the diagnosis, this was information found from a medical journal that I really liked on strategies to implement, right? Those words and conversation, those first giving that news stays with the family forever. And I've heard as many of the stories the story that I just told you, where maybe it wasn't delivered so well. I've heard many stories where it was delivered really well, and that stays with families forever. Congratulating, remember, nobody congratulated me and my husband, right? Congratulations on the birth of your child. Instead of bad news, is it unexpected, right? I have some unexpected news to share. And sticking to, maybe short term, what's next? Because when you get unexpected news, you can only handle so much. And so what's next? Where's the next follow-up? Getting that confirmation, that genetic testing, or maybe checking their heart, but going right to the next step versus, volunteering kind of this extensive timeline of all the possible outcomes and complications that could happen. So offering hope, also maybe not feeling that it's your job to be this pep talker, right? Again, we're giving kind of unbiased, and then offering resources, connecting with, I think the best thing is to connect with families, other parents, especially in the beginning, throughout, right? So yeah, I find you're at the stage right now. I'm at the teenage adolescent stage. So I try to connect with those parents that are just a few steps ahead of me. And we go through some of these questions. Again, this is done a lot slower than we're doing it now, where we actually role play. And, are we aware of our language? Do we say the words risk of having a baby with Down syndrome or a chance? Just light words that might help change perspective, bad news versus unexpected news. And that comfort level with just being able to hold space and not rushing to make someone feel better, and being able to see something from someone else's point of view. So in that role play with the residents, one is the parent and one is the doctor giving the diagnosis. And those that are on the parent end, I feel like have more aha moments than the doctor end, right? Because they have a chance to role play what it would like to be receiving the news. And I don't know if you guys are familiar with Brené Brown, but she talks all about different feelings and emotions, and talks about how the near enemy of compassion, right? So there's this idea of having compassion, but when does it move in, or could it move to pity, right? Of seeing someone else kind of from that distant versus true compassion. So I just caution on that fine line between what's compassion and what's pity. And I ran through that quick, but I got through it. So again, I'm Jennifer. Here's my contact information, my email address, and I'm gonna, if anybody has any questions, please let me know. Otherwise, Dr. Raz, I'll pass it off to you.
Hey, Jennifer and Dr. Raz, thank you so much. We may switch the order just a little bit now, if that's okay. Jennifer, you had such great content. It seems to me we needed 2 hours for this conversation, or a second conversation coming up. Dr. Raz, if it's okay, I may ask Ms. Archuleta to speak next. She doesn't have slides. That way you can have your slides completed at the end of her update. Liz, can I turn it over to you?
Sure. Thanks so much, Mark. And thank you so much, Mary Jo and NARBA Institute, for having me today. And just really appreciate the opportunity to talk a little bit from the perspective as a parent with the child with Down syndrome. And certainly this was kind of already teed up some, because we have a similar experience, Jennifer and I, in terms of how we were told our child had Down syndrome. So let me just start out first that I can tell you that Demetrius, my son, Demetrius Michael, I was not expecting that he had Down syndrome. It was unexpected. And so I always say that my experience was that I was a mom for about 3 hours, maybe less. And then I had a doctor come in and tell me that my child has web fingers and a continuous line on his palm and some other features, and that he just came out and blurted and said, there were visitors in the room at the time, and just said, your son has Down syndrome. And then literally turned around and walked away and said, you're gonna have to call your pediatrician and make an appointment with the pediatrician. So at that point, since it was unexpected, I literally became after that a researcher, a gatherer of any information I could possibly have. I became a scheduler for the number of tests that he had to go through. I became a transportation driver, taking him here and there and everywhere. And I can tell you that I was not prepared. You add that on top of a grieving process, and many parents will not talk about this because I think they feel like, should I even be grieving? Do I have the right to be grieving? But you go through a grieving process because it is something you didn't expect, and you had all these visions and dreams and plans for your child who was going to be a typical child, and now you have a child with Down syndrome. And I felt inadequate. And I will even go out there to say that I felt inadequate to be Demi's mom because I didn't know what to expect, and I didn't know what he was going to need. And so you have all of this emotion, you have all of these tests, you have all of these medical things that you need to be concerned about, and you are just very unprepared for it. And you don't know where to get information. So you go to the web, and it's not always reliable information, or you go to your pediatrician, and the pediatricians are not always well equipped to talk about Down syndrome because, rightly so, they're generalists, they're not specialists. And thankfully I had a great pediatrician who knew where to go to look up information and to tell me some of the basic things that I needed to be prepared for and the tests that I needed to have, and then send me to some specialists. So you get all of this as a parent, and you wonder, what is the future going to hold? Well, I can tell you that the future holds that, my child had 2 holes in his heart. My child saw all of the ologists you can possibly see, the urologist, the gastroenterologist, the cardiologist, the ear, nose, and throat doctor. My son saw the orthopedic surgeon. You name it, my son saw those. And then there were multiple surgeries that my son had, that my son had to have. So then you go through all of that, and it's very difficult on the family. And if you can, think about it, that you don't know, again, where to go and what to ask. And if you live in a rural part of Arizona, which Flagstaff is still rural, you don't have all of the access to the medical professionals that someone would have in a more urban area. So on top of that, then you think about the trips to Phoenix that are going back and forth to see the specialists. You talk about, is there a parent support, group here that exists? I can tell you that there is not. There was at one time, but it was loosely gathered, and there's not. So we don't have many people to ask questions of. What I needed at the time was a navigator. I needed a navigator to help me navigate through this process. And, I come from a background where I'm not afraid to ask questions. My husband's a professor. We're both highly educated. We have jobs and positions of great responsibility and authority, but yet it was still an intimidating process. So if I think about that, and I think about all the other parents who are experienced what we went through, it's daunting. It was daunting for us. I can tell you it's daunting for everyone, regardless of what your background is, what your level of education is. It's completely daunting. So in terms of a navigator, what we needed was somebody to be able to tell us, here's what you need to look for. Here's what you're going to expect in terms of the various medical items you need to look into, but also here's what you need to expect in terms of Division of Developmental Disabilities, and with getting your child in the schools. Here's all of these different pieces of paperwork and documentation that you're going to be required to do. And I really want to thank Jennifer and the work that the network did on House Bill 2113, because my son is also 13, and I can tell you that I had multiple years of having to prove that he had Down syndrome in order for him to be able to be part of the Division of Developmental Disabilities. And I can tell you that the paperwork, the quantity of paperwork that you have to fill out to be able to be part of DDD is immense. And the paperwork that you fill out is focusing on all the things that Demetrius couldn't do. It's not focusing on his assets. I mean, as a parent, I wanted to focus on Demetrius' assets, like what he could do, because my goodness, we celebrated the day that, you know, at 18 months that he, you know, was able to literally like walk one step. I mean, we celebrated the day he was able to form the word mama. I mean, all these little things that he did, we would celebrate because it took a lot of effort for him to be able to do that. But instead, I'm filling out a multiple page questionnaire, and it's asking me questions all about what my son can't do. And you have to answer the question, for example, can your child fasten a zipper? Well, you know, maybe he did it once a little bit, he was able to do it. No, it has to be, can your child do it all the time, every day with success? Well, no, he can't. Well, if you ask me that, there's not much then that my child can do all the time, every day with success, you know, at that particular time in his life. And so it's very, as a parent, you go through this negative process every single time you're trying to fill out paperwork to be able to get services and resources. So again, it would have been great if I would have been prepared for that. If someone would have said, like, you know, you're going to fill out this questionnaire, it's going to be really hard because it's going to focus on everything that your child can't do. And afterwards, you know, you're basically going to need to just think about that. That's how this paperwork works until we can change it. But here's all these other assets about your child. Here's all these great things your child can do. So that, and again, I didn't understand all the number of people that were going to be in my home, because when your child qualifies for therapies, there's physical therapy, there's speech therapy, there's occupational therapy, there's feeding therapy, and all of these therapists come into your home. And you're not prepared for that. You're not prepared for the number of people that are part of your child's life. I didn't realize that. So as I think of everything, and I think of Demetrius going from being an infant to a child, going through the school system, which, you know, those services are siloed because he receives therapies in school. He receives, of course, special education at school. He receives therapies at home through DDD, and those two systems don't talk to one another. They're very much siloed, and then he has all the medical attention that he receives, and that's not necessarily also integrated. There's nothing integrated. And as we go through the different stages from infant to childhood to now a teenager, and then being prepared to go to an adult, the next big thing that a person has to think about is, my child is 13, and at 18, I have to make a major decision. And that is my child going to be under guardianship for the rest of his life or not? And you think about, okay, what are the pros and cons of that? What are the resources attached to that? You know, one of the things I think about as a parent is, how am I going to make sure that Demetrius is financially taken care of, not only while I'm alive, but past my death? That is a very real concern. How am I going to make sure that happens? And if he's 18 and I make him under permanent guardianship, how does that affect and impact his life? That's a huge thing, and one that I can tell you I'm barely starting to explore. It's difficult to explore it, but I know we have to. And then you worry about all the other things along the line, just like every typical parent. Of course, you worry about friends, and you worry about your child being able to receive being welcomed by community and being embraced by community. You worry about all of that. On top of that, you worry about the health issues that continue throughout your child's life. So I can sum it up by saying I've had this, this revelation, and it, as I was preparing for this, this discussion, it dawned on me, if I had a magic wand and if I could do one thing, I would say there needs to be a boot camp for parents. I'm talking about like a weekend or a 2-day type of boot camp. And that basically brings in, just like we're doing today, brings in, experts, resource groups, pediatricians, some specialists, people just to be able to equip parents with the information that they need to be able to provide their child with, all of the support, because the parents and the families need the support in order to then support the child who has Down syndrome. And if it was just practical things, medical awareness, if it was awareness of the DDD process, awareness of the school process, awareness of resource groups that are available for parents, just milestones that you need to be looking out for, even how to just maintain balance and your own emotional and mental health. There's a myriad of topics that could be discussed. But that is lacking, and that is one thing that I would do. And I'd probably have a boot camp for infants, for parents who were just had a child who was born with Down syndrome, parents like me who now have a teenager, and then for family members, friends, or even support system of an adult with Down syndrome. I feel like those are the 3 kind of milestones that would be great to have a boot camp around. So with that, I'll just close by saying that, I'm a fierce advocate for my child and for other children with Down syndrome. I've learned so much, and I can tell you that my life is so much better having Demetrius in it. And I can tell you that I know exactly why I'm Demetrius's mother. So when he was first born, this feeling of being inadequate to be his mother has become very clear to me in the past 13 years, why I'm his mother, because I intend to make life so much better for him and for other children with Down syndrome. Thanks so much.
Gosh, thank you so much for sharing those very important reflections. Jennifer, did you want to respond? I saw your
I wanted to say thank you so much for sharing the story, and I look forward to hopefully meeting you and your son one day in person. But real quick, I just wanted to say is that Down Syndrome Network is in strategic planning mode right now. And we have this idea, you defined it a little clearer, of this boot camp. So I just wanted to say thank you for bringing that up. And there's 3 positions that we're looking at from my experience of being here for the last 10 months, is that parents, are looking for what we'd call like a community health navigator. And then the other questions that come into play are an education advocate for all the things that happen during, education, and then the transition into even adult education. And then the third kind of guide would be what I'd call like an adult transitions guide. So especially with people living to 60, housing, because caregivers, will die, and then who's taking care of their loved ones. And so those kind of 3 roles, community health navigation, education advocacy, and this adult transition guide, are 3 areas that we would like to really bring on board and get funding for. And then these people could help us run the boot camp. So thank you, Liz.
No, thank you, Jennifer, for adding that important information. It's great to identify those synergies. Dr. Raz, did you have some, thank you for your patience. Do you have any additional comments you'd like to bring from your perspective as synergy for these just remarkable stories and shared with us by both Jennifer and Liz?
Yeah, I certainly have a couple things to add, and thank you so much for having me. And Liz and Jennifer, your presentations, your discussions are just so important, and it's part of why I love what I do, is because I get to work with families just like the both of you in the community, which has, as a medical provider, has allowed me to, has given me purpose, and it's really, I'm just so grateful to be part of the community and being able to take care of these wonderful children and all of their wonderful family members. So I have a couple slides. Let me just share them. A little bit of a lengthier presentation, but I will share just a couple ones that I think will be important. I think just latest kind of, let me see.
I'll help you so you can focus. I was impressed that you were able to talk and get your slides up. I don't have that skill, so thank you.
Yes, thank you. So I just wanted to touch that there are healthcare guidelines for children and adolescents with Down syndrome. They're in May 2022, so just a few months ago, were newly published guidelines. And I just wanted to kind of highlight a little bit about them, a few things to know. The last update was in 2011, so we were really excited to have these new guidelines. There are a few things that are the same, such as hearing screening frequency, screening for atlantoaxial instability. Recommendations are still the same, specifically that it used to be that regularly we would recommend kids get x-rays of their necks to make sure there's no instability. And now we don't recommend that. It's just based on, screening and symptoms that we look for. Thyroid and celiac screening are the same. But a few new things are, one, which I think is a really important addition, is discussion with the family about having a child with Down syndrome or this unexpected new diagnosis. Just like Jennifer had highlighted, really the ways to have this discussion that's based on information provided by families who have a children with Down syndrome. What are their experiences? And what were their experiences, and how we as a medical community can continue to improve the way we discuss this with the families at the time of diagnosis. And just some varieties on other aspects of medical care, such as checking iron stores annually, differences in the way we can check vision, dermatologic additions, and emphasizing safety and community resources. So there is on healthychildrens.org updated guidelines for parents. So parents can always go to this to access that in a way that's easy for them to work through and understand how to go through that with their family. I won't go through this. Sorry for skipping through. I will send in my presentation so everyone can read through this. So after birth, there are certainly some things that are recommended as far as medical evaluations. But what I also wanted to say, which is kind of goes with what Jennifer and Liz said, is it's really important. I always highlight this to residents, to other medical providers that I work with, that it's not only just important to make sure that we get through the medical evaluations they need, but we also need to set the families up for success once they leave the nursery or the NICU or wherever their child is at discharge. And so that's making sure they're plugged in with early intervention services by putting that referral in before they just get discharged, so that they're contacting the family, providing them with the community resources. So Gigi's Playhouse, Down Syndrome Network, Sharing Down Syndrome. Those are our family groups that are, like Jennifer said, the best resources for families. Other families are these families' best resources. And there's other more national groups as well. I'm just gonna check so I can be mindful of the time. I wanted to talk about something that Jennifer also highlighted, is that while we do keep a close eye on development for these kids, because we do know that that we do see delays, it is such a broad spectrum, right? And so it's really important to keep an eye, but also provide families with the resources to be able to get that support they need to maximize their child's growth and development. a little briefly about autism. So we do see dual diagnoses in children. And so again, we want to be able to keep an eye on this and monitor for it so that parents can be aware and be able to access those supports and services should that dual diagnosis be part of their child's life. Okay. I'll have all of this in there. This is really just reviewing those healthcare guidelines. Part of the healthcare guidelines that I think Liz and Jennifer highlighted is not just the medical piece, but the anticipatory guidance. So it's, as kids are getting to school age, talking about getting an IEP, accessing services through the school system, talking about puberty as they're getting closer to puberty, how they can support their child in those changes that are happening with their body, safety, so safety in the community. And then again, transition planning is a big part of what we want to discuss with these families as their child's getting closer to 18 years of age. Which includes getting to medical transition planning, finding adult providers to be able to provide inclusive care for their child, safety, sexual health, and hygiene as well. So sorry that was run. I ran through that quickly. Again, I will send my slides over so everyone can take a look at that. But I just am so grateful to be part of this community. And Jennifer and Liz, your presentations were just so phenomenal. So thank you for that. And I will stop sharing.
Dr. Rez, thank you. I appreciate the work that you're doing and leading and teaching others and supporting the needs and the complex needs of families across the state. And I think today's panel demonstrated a few things to me. The first is that topics like this that are so rich are difficult to consider within the time frame of an hour. And I offer that as an apology both to our panelists as well as to those attending today if there are certain aspects of the conversation and of this very important subject that we didn't have time to get to. Jennifer, Dr. Raz, if folks have questions though and follow up, in addition to reviewing your materials, Jennifer, are you able to share can we share in the chat your connection information that folks can reach out to? Would that be appropriate? I gave the thumbs up. Thank you. I appreciate the comments and that were made in the chat from some folks, and mostly appreciate the just compassionate, human, heartfelt engagement from all the presenters today and sharing your stories. Often in healthcare, the medical story goes first, and we thought the human story so important and so key that Jennifer, you and Liz identify was important for today. That human story is rounded by and should be supported by the medical profession, but some of you may still have questions if you've joined as families with this particular interest, and so we encourage you to please reach out to resources. Jennifer's put the contact information in the chat where you can connect to her, and Jennifer, thanks for then your help connecting folks to help answer questions if you may still have them after today's presentation. But thank you to our panelists and to our presenters for the work you do and for the rich perspective that you shared with us today. Jennifer and Liz, if I may share with you as a pediatrician, I respect and honor your expertise in your professional lives, but your humanness and the heart that you brought today as moms and as leaders in community as moms, I will not forget. Thank you to everyone who has joined us today. Best wishes to you for continued, hopefully good and stable health in the weeks ahead. I hope you have a happy Thanksgiving. Please stay tuned for announcements of future topics in 2023 of the Arizona Community Grand Rounds, and let us know how we can make these sessions better. And I'll just leave with a final note of thanks. to our presenters today. Be well, everyone, and please spread kindness. Bye now.
Thank you.
Thank you.